Welcome, dear friends. Well, good morning, good afternoon, good evening, wherever you're joining us from around the world. Bienvenue, karibu sana. Akwaba, mawia, welcome. We are delighted to have you with us this evening. Well, my name is Lydia Muragori, and I will be your host this evening. Whether you're joining us from Africa, Europe, Asia, America, Australia, or anywhere else around the globe, we warmly welcome you. A very special welcome to people who are living with diabetes, family members, caregivers, healthcare professionals, students, and even our DTLC alumni. And of course, everyone else who has chosen to spend their time with us. We come together because diabetes is one of the greatest health challenges of our time. Across the world, more than 500 million people are living with diabetes, and millions are at risk without even knowing it. Every family, every community, and even every country is being affected by diabetes and its complications. Yet, despite these numbers, many people living with diabetes still do not receive the education, the support, and practical guidance they need to manage their condition confidently. As the famous educator Derek Bock once said, if you think education is expensive, try ignorance. When it comes to diabetes, the cost of ignorance can be blindness, kidney disease, heart disease, amputations, a reduced quality of life, and lives cut short far too soon. But there is good news. Knowledge is powerful. Education changes outcomes. Well, when people are given the right information, practical tools, and ongoing support, they can make remarkable improvements in their health and well-being. And that's why tonight is such a special evening. It marks the beginning of something bigger than a program. It is the beginning of a movement to make diabetes education accessible to everyone. So, for the first time ever, Diabetes Total Lifestyle Change, DTLC, is being offered free to the public through YouTube. For the next 12 weeks, we will walk this journey together, we will learn together, grow together, and ask questions toward better health. Well, whether you have lived with diabetes for 20 years, whether you were diagnosed last week, whether you're caring for someone with diabetes, or simply just want to protect your future health, this is the place for you. So welcome to DTLC Season 13. Over the past 12 successful seasons, we've had the privilege of supporting hundreds of people on their diabetes journey. We have seen participants lose weight, improve their blood glucose control, lower their HbA1c levels, and gain the confidence to manage their diabetes effectively. So tonight we open the doors the doors of DTLC wider than ever before, because we believe that life-changing diabetes education should be available to everybody. So, what can you look forward to in this session? You have probably heard us mention the letters DTLC. You may have seen them on social media, had someone talk about the program, or perhaps this is your very first introduction. So what exactly is DTLC? There's no one better positioned to answer that question than the visionary behind this initiative, Dr. Ojwang. We will also hear inspiring stories and experiences from past DTLC participants through our diabetes care specialist, Ms. Atieno Jalango. And then finally, we will show you exactly how to get started with DTLC Season 13, including how to participate and what to expect over the 12 weeks. So sit back, get comfortable, and most importantly, keep an open mind. So let's get started. So what exactly is DTLC? Where did it come from? Why was it created? Well, to introduce this topic, it's my privilege to welcome a respected dietitian, an educator, a researcher, and diabetes advocate who has dedicated more than 27 years to helping people live healthier. Dr. Alice Ojwang is a registered dietitian, diabetes educator, a university lecturer, and a mentor. Over the course of her career, she has actually supported more than 5,000 individuals living with diabetes, obesity, and other lifestyle-related conditions to improve their health and the quality of life. So when she speaks about diabetes education, lifestyle change, and the possibility of a better future, she speaks from both knowledge and lived experience. Dr. Ojwang, we are honored to have you with us. Please take us through.
Good evening, everybody. It's nice to be here. Thank you, Lydia, for that warm introduction. And thank you, everybody, for being here and the ones who are watching from somewhere in the world. Karibu sana from Kenya. So, as Lydia has put it rightly, what is the DTLC? DTLC stands for the word Diabetes Total Lifestyle Change Program. Why did I start this program? This is because I've been managing diabetes for over 27 years, as she said. I've been working with different people with type 1, type 2 diabetes. And in my earlier career as a dietitian, I depended on doctors to refer patients to me or to refer people to me, anybody with any conditions. But what I found is most of the time when the diabetic person actually found me eventually, they were always they always had very high blood sugars and they were already out of control. They already had a complication. But from studying diabetes and liking it and going to school and learning more about diabetes, it is actually something very easy to manage, okay? And it's only easy to manage when you have the knowledge. So I understood it and I help people to manage. In my earlier career, I was also working with Dr. Jean Suren. Oh, she's a nurse. She's an American nurse who was in Kenya working in diabetes care. She taught me diabetes. And I was also working with Dr. Jalango, who is here, who was one of my mentors. And I remember one morning she had this blood glucose meters she was given to try and test them to see if they're giving the same kind of blood sugars. And so who was it? She tested it on me. And when she did that, my sugars were actually high. I found that the sugars were very high. And then she was like, oh, what's going on here? So she told me, okay, you go home and we test it again tomorrow. So that was a random blood sugar sometimes in the evening. It was high, I can't remember, but it was an alarming. So the next morning, she told me, don't eat anything after 8 p.m., and then come tomorrow morning and we test your sugar. And when we tested the sugar, it was high again. So that means she actually diagnosed me with type 2 diabetes. And so I panicked. I personally don't like medication. So the thought of actually taking medication was very scary. You can imagine how much medication you have to take. Sometimes, you can take many. You find that this is maybe what you take in a month or 2 months or in 1 week because you're taking so many medications. Anyway, fast forward, I changed my lifestyle and I was not on treatment for a long time. Within 6 months, I was out of treatment. And up to now, I have not had any problems. So tonight marks the beginning of something exciting. We are launching this health program for people because we know that many people have living with diabetes and many people struggle with diabetes. So you have a parent who's diabetes, you have a relative who diabetes, it costs so much money and you're always worried that they're going to get a kidney problem, they're going to get an amputation. No, because diabetes can be managed. So many people, of course, receive diabetes diagnosis and are sent home with medication, but very little education. So over the years, I found that many things matter. What should you eat? These are the things you ask. What is my blood sugar? When is it high? What is a low blood sugar? Can I still enjoy food? And then people, of course, because they don't know what to do, you're either eating very boiled food, you're eating really boring food, you're eating too much of the wrong thing, you're confused, don't eat this, don't eat that. Then, of course, there's always the worry of, can I really prevent complications? And is diabetes remission possible? Somebody who doesn't like medication will actually work very hard. But to be honest, a lot of us don't ask questions. We don't ask questions when we go to see the doctors. If we ask questions, you will actually get better treatment. So anyway, we know that diabetes is not just a disease of blood sugar. It affects every aspect of your life. Your eating habits, physical activity, sleep, stress levels, emotions, relationships, and definitely overall well-being. So this DTLC program, it is a journey from confusion to confidence. We've worked with so many people, and I mean, we've evaluated, and they said they have 95% confidence levels of managing their diabetes on their own. And that's what we want to do. We want to be able to educate you so you can manage your own health. We're able to educate you to discuss what are your numbers, what is a good blood sugar, what is a bad blood sugar, at what time is it bad. And sometimes you meet people and they say fasting, oh, my fasting blood sugar is 10. It's okay. It was 10 and I feel good. I'm like, no, 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 no. That is a very high blood sugar. If you get 10 2 hours after meal, then it is actually raised. It's not high, it's not good, but it is raised. So you need to know what is a good fasting, what's a high fasting, how does your food affect all these things. You get, okay? So in short, we have done this for since 2022. So this is like how many years? 4 years. We've seen people reduce HbA1 levels, they drop, people lose weight, they reduce medication, and some actually stop medication completely. And we don't stop you, we actually work together with your doctor. So please note that we will educate you, but you will work together with your doctor. We will try to have a public WhatsApp support group, and we will work with dietitians, our nutrition interns. I lecture at the university. We have some students. They will help us answer all your questions on Zoom. So really, as a dietitian of 27 years experience, I have the knowledge, and I know if I tell you to do something and you do it, I can promise you that you will make a difference in your diabetes care. Sometimes somebody called me and says, "Oh, can I join for my mom or my friend because they don't understand?" I'm like, perfect. So join and then interpret for them so that they can understand. So we made this decision because DTLC is coming to you free. Why? We made this decision because diabetes education should not be a privilege. It should be accessible to everyone. And I know I'm in the second half of my life, and I will be so sad if I was in my hospital bed dying and I haven't done this for majority. So we want each and everyone to have accurate information. So please share this information. And once we get funding and we get more people, we'll be able to translate it in some other languages like maybe French, Swahili, Arabic, something. We will be able to translate this. So we need your support to do this. So our vision is to empower you, empower your friends, empower your family, and millions of people living with diabetes to gain knowledge, skills, confidence needed to live healthier, longer, and more fulfilling lives. Yes, somebody living with diabetes can be free from complications. It is possible. You can go into remission. You can reduce medication. You don't have to take lots and lots of medication. So over the next 12 weeks, we will walk together through different topics such as understanding diabetes, blood sugar monitoring, healthy eating, carbohydrate intelligence, weight management, physical activity, circadian rhythm, food care, mental well-being, diabetes technology, preventing complications, and many others. So we will be posting every Monday at 8 p.m. You can go to YouTube and you will find the session. So my invitation tonight for you is very simple. Don't be a passive listener, okay? Do not be an observer. Become a student of your diabetes, either for yourself, for a family member who is living diabetes, or just for knowledge, so that when you meet somebody who's living diabetes, you give them accurate information. Participate, take notes, Ask questions, make us busy, bring out the best in us, apply what you learn, and definitely don't keep this information to yourself. So, what would help us is if you can spread the message, subscribe to our YouTube channel, and then you, of course, click the notification bell, invite others to join you. Remember, diagnosis is not the end of your story. With the right knowledge, support, and action, you can regain confidence, improve your health, and live better. Thank you for joining us as we launch season 13. So, thank you very much. Over to you, Lydia.
Mhm. Well, thank you very much, Dr. Ojwang, for sharing the story behind DTLC and the vision that has helped so many people take control of their diabetes and their health. Your message reminds us that diabetes does not have to define our future. With the right knowledge, support, better health, and even remission for many with type 2 diabetes is actually possible. So thank you so much for your passion and the commitment. We sincerely appreciate. And we look forward to journeying with you over the 12 weeks. So numbers tell part of the story, but behind every number is actually a person, a family, and a life that has been transformed through education, support, and lifestyle change. To take us through the DTLC achievements and success stories, it is my pleasure to introduce Ms. Atieno Jalango. Ms. Atieno Jalango is a diabetes care specialist with a passion for supporting people living with diabetes to achieve better health outcomes. She has worked with participants throughout their diabetes journeys, witnessing firsthand the challenges they face and the remarkable transformations that they've done. She brings valuable experience from working directly with people living with diabetes and has been an integral part for the DTLC team over the years. As she shares the DTLC achievements, I encourage you to listen carefully. The stories and outcomes you're about to hear are a reminder that positive change is possible. Ms. Atieno, we are delighted to hear from you.
Thank you so much, Lydia, and also thank you to Alice. And I'm really, really happy to be here and also to welcome each and every one of us to yet another season of DTLC. It is a fresh journey of purpose, change, and transformation. Over the past few years, since 2022, we have seen tremendous things happen. As Alice aptly mentioned, it's about coming from confusion to confidence. It's a journey that has taken us towards diabetes remission. We have seen people change their lipid profiles, getting better outcomes health-wise, and as well as in quality of life. We have seen even other conditions that we had not set to tackle go into remission. We have seen arthritis go into remission. We have seen systemic lupus erythematosus go into remission, and even cancer. Adopting a healthy lifestyle is an investment for life. So, as we are here today, it's a fresh journey of purpose, change, and transformation. So, to the DTLC alumni, thank you for your faithfulness, for working with us in the past few years and even in early this year, the ones who are in the past cohort. And to the new and prospective participants, I think this is your moment to take a chance to rise and shine. DTLC has the ability to transform your life. But most important is to remember that change begins the moment you decide to show up. So this evening, I'm glad that you showed up, and we are grateful as you commit to taking up the knowledge and skills to change your life and have a better future. A diagnosis of diabetes does not necessarily mean a death sentence or a commitment to complications. No, all these things can be averted, as Alice showed us. In DTLC, we work together to learn, we work together to grow, to change, and to impact our lives. So at DTLC, it is a collective bargaining. We work together, we hear from you, we learn from you, and we also impact you. We believe that everyone should have a fulfilling and productive life. So I will definitely urge you to step in with expectation. This season holds something powerful just for you. So next, it would be nice to hear from some of our amazing DTLC alumni. These are some of our champions in the past season. Why do we call them champions? Because they made remarkable changes, tremendous drops in HbA1c. Some were able to change their blood parameters very well, lose weight, and get a great sense of well-being after walking with us through the DTLC sessions. So we are going to begin with some recordings from past alumni Linda Kavulani, who has type 1 diabetes, and Victor Mbao, who has type 2 diabetes. Over to you, Lydia.
Good evening, Linda.
Good evening.
Thank you for being here. You're a very active and happy participant. So, simple question. So, why did you join DTLC?
I joined DTLC because it was an invitation and a challenge from you. We met at a friend's office.
Yeah,
I think it was just destiny that we met there. And you said a statement that stuck with me. You said, nothing is too expensive when it comes to your health. And even offered to give a discount so that I joined the program. So that is what motivated me to join. I had not heard of DTLC before that day.
Okay. And what is the other reason why you joined this particular program? Yes.
Oh,
Nothing
okay.
is too, yes.
To learn how to manage my sugars better and just find a sustainable, I don't know if I should use the word diet, but find a sustainable way of managing diabetes, because I had tried other ways, but they were not sustainable.
Okay, thank you so much, Linda. And what type of diabetes do you have?
Type 1 diabetes.
What does that mean when you're type 1?
It means that the pancreas is not producing insulin, and therefore you need to inject to substitute for that.
Yes, so to control your blood sugars, eh? And so when
Yes.
your blood sugars are not controlled, then definitely it gets you into trouble, short term and long term. And why we're here today is because this DTLC was specifically for people living with type 2 diabetes. We had some people who joined who are not living with diabetes, but this was the focus. So we ran different DTLC for people living with diabetes and for people without with just lifestyle condition that needs to improve them. So Linda,
Yeah.
what did you learn in DTLC? And just tell us, what did you like? How did you manage your sugars? Yeah. How have you benefited?
So, yeah. At first, when I joined, I looked at the daily challenges, and this was both when it comes to diet and even in the workout, regarding the workout when the pace are up. So looking at both like guidelines, I just laughed and said, can never be me. And then slowly I saw people posting their progress on the WhatsApp group, and then they started posting the food, the blood sugar readings. The blood sugar readings was sensitive for me because I knew I was not in the green zone. It was always, 15 and above. And so the fact that we were taken through carbohydrate intelligence, I think that was the first session I attended. And then now I started understanding I need to limit to 1 carbohydrate per meal. That really became a game changer for me. I also used to take a lot of juice just out of anger because I felt like I'm doing everything, but my body is not responding, and it's not like my pancreas will wake up one day. So why not? YOLO, you know? And that's how I ended up taking the wrong foods. And through the program, I've been able to learn that you can moderate. If I choose to take a fruit, then let it just be the fruit for that meal. Let that fruit be the carbohydrate for that meal. So carbohydrate intelligence stood out for me. And also, I never ever thought I would go above like 5,000 steps in a day without being forced, or like a lion is chasing me or something. So doing this just for health was, eye-opening, and it was challenging. But this week I decided I'm going to do my best and make sure that the average is 10K. At the beginning of the week, it was 9K. I'm sure right now it's towards 10K. And the fact that there were multiple, how are they called, specialists, whether it's about sleep, footwear, that really helped me. And of course, the participants as well. I've seen foods that I had never heard of, so that really challenged me to do better.
Her sugars were 15, 16, 20 sometimes. But how are your sugars now, Linda?
In fact, I've just taken the reading right now before dinner, and it was 5. I think all the readings I've taken today, they were below 10, and I am so happy.
But even there are times you got hypo. So we should never be scared of discussing our blood sugars publicly, because diabetes is a condition that, affects the way your body uses food. And if your family do not know, or your friends don't know your diabetes and your blood sugars and how food affects your blood sugars, then sometimes they can influence you negatively. So it's very important to talk about it. So Linda, what message? Okay. So I know you've talked about many changes. You've talked about carbohydrate intelligence. Can you just say in one line what that means? Don't use the carbohydrate intelligence term. Use, what does that mean for you?
It means portion control. That's what I'd say. Guilt-free portion control.
Yes, but carbohydrate portion control, right?
Yes.
So what would you like to tell somebody Linda is a very young person with type 1 diabetes. And like you see, she was saying, she would just take juices, which of course would drive her sugar crazy. But she has done very well. So Linda, there are young people who have had type 1 diabetes. They're tired of taking injections every day. They are tired of managing their diet. What can you tell them?
Yeah, so first, I'd like to clarify that the blood sugar readings of 15 were before meals, not even after. And then the other thing I want to just say, I'm a type 1 diabetic, so I wouldn't say that my pancreas suddenly started working, but this program has made so many changes for me. And what I'd say for any type 1 diabetic out there, it's a tough journey. And the best part about this program for me was having trained nutritionists. I insist on the word trained because I have been a product of online misinformation. I have tried keto diet. I have tried anything with the hopes that the pancreas would suddenly start working. I've tried fasting. I was supposed to do 72-hour fast. I don't know how I would have survived that. So walking this journey with trained professionals would really help. And as much as it's a lifelong condition, managing it to avoid complications is very key. So I'd encourage them to try out this program. It would help them manage the sugars better.
And so thank you very much. Thank you so much for sharing your story. What motivated you to join the DTLC program?
Around August of this year, I noticed some symptoms. For instance, I was feeling excessively thirsty and all that. And I thought of just passing through a hospital next to my place of work to have a check. And so I got there after work, I got there and they did a few tests, and the sugar test came out as 21. Of course, then I didn't know what 21 is. I wasn't familiar with the figures about the parameter. So when I was told that the normal is supposed to be, below 7, there between 5 and 7, there was a cause for alarm, and they actually told me that I wouldn't be allowed to go home until they brought it down. So I was admitted for a few hours, and they managed to bring it down to about 11 and put me on medication and said I should go back 2 weeks later. 2 weeks later, the sugars were still high. I think they were about 15. So I was told, Mister, you are officially a diabetic, and we're putting you on medicine. I was put on Triviamet, which I took twice a day. And yeah, it was quite a depressing discovery because I never thought I would get such a condition. So I told a few people, including a few friends from the office, and one of them happened to have attended this program a few years before. And she said, well, you need to join this program. It's a good support program. I went through it. It was very helpful. And the best part was that the insurance, our insurance at the office paid for it. Okay, then I have nothing to lose. So I enrolled, and yeah, it was a great decision, as I discovered. Yeah, so basically that's how I found myself in the program. Yeah.
Okay, thank you so much. And of course, you've been a very active participant, eh? So what changes have you made in your life since you joined DTLC in terms of your lifestyle?
Yeah, so I've made a number of changes concerning what I eat, when I eat, in what proportions I eat them. There have been changes in my exercise life. For instance, we are encouraged to do at least 10,000 steps per day. And that is done in such a nice competitive way, I should say. Maybe it's because I'm competitive, but because we are comparing how many steps we are doing each day, that really encouraged me to go beyond the 10,000. So sometimes I'll do 15, sometimes I'll do 20,000 and all that. And though weight was not, it wasn't one of the whys, my main why was to stop taking medication. But I found that with adjustments to my diet and my exercise, I began to lose weight. And so from the time I joined to this date, I've lost 5 kilograms. I was 83, now I'm at 78, and I feel quite light. And that has the effect of actually me going for even longer walks, because I feel light, so I can walk longer, I can run longer, and yeah, so it's a very good cycle that has happened. Yeah.
Yeah. And so are you still on medication for your diabetes?
No. About halfway through the program, I began to get comments from the facilitators urging me to go and see my doctor. So one day I took all my records. Of course, we were recording our sugars. You know, when we wake up, we record the fasting glucose. 1 hour after a meal, 2 hours after, we make those records. So I took the compilation of all these recordings. I went to see my endocrinologist. He had a look through them and he said, well, from what I'm seeing, you do not need to take your medicines anymore. And he actually gave me a choice. He said, you can either stop today, or I can begin to reduce the dosages gradually. So he says, either way, it works all right. So the choice is yours. And of course, I chose to stop immediately. And he said, well, you continue to monitor the glucose readings. If they stay high, then you may need to come back. But if they drop, then you don't need to come back. Yeah, so I stopped taking the medication halfway through the program.
Yeah, thank you. Thank you so much for sharing that. And so let me just repeat this. Diabetes is a condition that affects the way your body uses food for energy. So when you change your diet, and we're not starving anybody. Victor, did we starve you?
Not at all. No. In fact,
Yeah.
you know what? I was a bit anxious because I thought you were going to say I should stop eating my ugali, and I really love my ugali.
Yeah, thank you. Because most people think that when they go to the dietitian is going to tell them, don't do this, don't do that, don't do that. No, no, no. We empower you so that you can make very good decisions. So thank you so much, Vika. So what would you like to say to gentlemen?
Gentlemen, yes.
The one who are listening now and later. Yes.
I would want to convey to my fellow gentlemen is that through this program, I have learned that meals can become very exciting. Meals can become richer and more diverse. We've learned how to incorporate new ingredients. I was a master of experiments. Whenever I saw something new that somebody has posted, I would go and try it out. The other thing I would want to share is, how we learned about mindful eating. That, we don't sit to eat and within 5 minutes, the plate is clean. We need to enjoy and, take the ingredients in our mouth and, taste every part of that meal and take our time to savor the food. And in so doing, we actually allow the body to send messages that we are satisfied. Because sometimes when we eat too fast, the body does not have the time to tell us that we are full, and so we end up overeating. But when we take the time to enjoy what we are eating, the moment we reach that point where we are full, the body will tell us that we are full, and we may not necessarily need to finish what's on the plate. So that has been very helpful for me. And the other thing is sleep. The quality of sleep has improved. I used to put my sleep like maybe 4 times in a week. I would wake up at 03 and go back to sleep maybe around 5. But I found that if I avoid taking carbs and animal source proteins at dinner time, I really enjoy my sleep. So yeah, the program is very beneficial, and it's not just about food. We've had opportunities to have mental health assessments, how we look at food and emotional eating and all that, why we want to reach out for that biscuit at any time and how to control all that. I also had the opportunity to see a food doctor because food health in diabetes is very important. And I learned a few things that I never knew about my own feet, which will go some way to improving my food health. Yeah.
Yeah. Oh, Victor, thank you so much for sharing your story.
Thank you so much. Now we have one of our esteemed alumni and champion who is joining us today live, Mr. Leonard Midigo, to share his experience with us. Mr. Midigo, are you online?
Yes.
Excellent, lovely. I can see you. You can unmute.
Yes. Yeah, very good.
Yeah, now you're on mute. Good evening. It's a pleasure to host you once again. And we were really happy to have you in DTLC. I'll just like you to share your experience, praying that it will also assist somebody else who will be joining us from in this season. Now, Mr. Midigo, which sessions did you join DTLC? I think you joined us for more than one session.
Yeah, I think I did, I think 9. I think that's when I got in. Then I came in at 11.
Yes.
Yeah.
So what motivated you to join DTLC?
Well, I would say that I've been diabetic from the year 2006.
Yes.
Interestingly, the person who told me that I'm diabetic was Dr. Nyawera, whom I didn't get to know until the other day when I went now to visit her again. And then she found my records. Then I'm like, oh, you must be the one, at Acacia. But that time I was young, so I didn't really take it serious. Although my dad was diabetic, so it didn't really come as a surprise.
Yeah.
But along the way, I was happy, no, not really happy, but I'm always happy to talk about it,
Yeah.
about the diabetic, and having gone through many sessions with different doctors.
Yes.
I think there's so much I know, but still my sugars are not, going down. So one time at my workplace, there's a colleague who had
Yes.
me, we were talking with another guy because he was saying, oh, gee, the sugars have gone high. So I was telling him, do this, do this. Then he had a stalk. Then he said, okay, why don't you guys try this?
Yes.
And, there's so many things to do with diabetes. You get to hear this and that. So I said, okay, let
Yeah.
me try. So I joined, I was given a link, which I thought probably is a hoax,
Yes.
So I listened because I was so keen to listen. Then it was not all about marketing, marketing this drug. It was just simple, basic things to do. Then that's how I got really interested. And it had to do with exercise and food, and nothing to do with insulin and all this. So that's how I got to join.
Awesome, awesome. And what was your most favorite topics? One or two topics that really impacted you?
Well, I wouldn't say much, but I was so
Yeah.
keen at everything.
Yes.
The most unfortunate part is that when I posted the first day I posted my food, Dr. Ojwang picked those ones. And, it was well served. And that is when I was told, okay, look at this one, this one, this one. Then I said, okay, fine. Well, it was good. But since then, I didn't post again. Not because I didn't want to post, but now I
Yeah.
learned.
Yeah. Guilty. So, yeah. So, how did you benefit from this program?
No, it was really, really beneficial. Actually, my sugars have been not stable. I've been doing insulin, done all those drugs up to some point. I now refuse to do them. Then I also travel.
Yeah.
Especially there's a time I was in Rwanda, the food it becomes a challenge, and where I work, we are cooked for. We don't cook
Yes.
for ourselves. So you find that you mainly don't have a choice but to sometimes eat what you get. So when I joined this with the exercises and the challenge of that walking, and if you notice my steps perhaps in a day was sometimes very higher than almost everybody until
Yes. You did very
11.
well.
11 is where I got a challenge. There was a lady who was constantly at 16. I used to wonder
Yeah.
what's happening,
She gave
And
you a run for the money.
yeah, there's a gentleman who did one day, I think around 35. I said, okay,
Yes.
the whole night I was on a treadmill until I beat him at 40 something, right? So you could find that the readings would go all the way down to 4, 5. The sleep comes in, so it was really, really helpful. Now the challenge is that when you're out, and that's why I came in the 11, because when you
Yes.
leave, you leave, you tend to go back to your ways. Like now, I left, uh, gone back to my ways. But you see, when you're in with that discounted rate, so you find that always is a challenge. There's a challenge.
Yes.
You want to do things, but when you're out of the program, you end up just going back to your old ways, which is
But
quite
have you gone?
unfortunate.
Have you joined the community? You
Not
have the
yet.
community.
Not yet.
Okay, so we'll usher you in there. So
all
what
right.
would you advise somebody who is considering joining this program?
No, it's one of a good program. Nobody's asking you for many things. It's basically educating you on what you need to do. Telling you not to eat meat, which again for me it's become a real challenge. Because if I don't eat that, I do sports. So you find that sometimes if you want to put me like a sungura eating just vegetables, by midnight, ninja completely. So, but we work it out. Many times you find that it's a very important, it's a very good program.
Yeah.
Very,
But
very
the
good program.
recommendation for meat is only for evening. Like breakfast and lunch, you can eat meat. Have you tried that?
Yeah, and the challenge is sometimes you go do some sports, so by the time you're coming, if you just eat vegetables, by midnight there is no sleep.
Okay,
That's
that can be addressed still by adjusting a few things here and there. So we could take it that later. Thank you so much for a very, very candid review of the program. We really appreciate your presence. And to also Linda and Victor, who are also part of this review. We are glad for their review and also pray that their stories might spark someone else's transformation this season. So, as Linda said, when it comes to your life, nothing is too expensive. So, the call is for us to join up with purpose and consistency because lifestyle change begins the moment you decide to show up. So, let's show up. Your presence will be valuable this season as a start of something truly life changing. And we are glad to be part of your individual journey. So, back to you, Lydia.
Well, thank you so much, Ms. Atieno, for that insightful session. The achievements shared here remind us DTLC is more than a program. It is a community that empowers people to make meaningful and lasting changes in their lives. The success stories improved health outcomes and life transformed give us hope and confidence that diabetes can be managed successfully with the right knowledge, support, and commitment. Now, we'll take a break at this point. We'll take any questions that you have, any comments, any burning questions. This is your time. Feel free to unmute. Feel free to raise your hand and talk to us. Yeah, good question there. Kindly explain diabetes type 1 and type 2. What's the difference?
Dr. Jalango, go for it.
Yes, thank you. There are essentially two types of diabetes, although diabetes can be divided even into further subtypes. Diabetes is a very complex metabolic disorder. When I talk about metabolic, what do I mean? It just concerns building up and breaking down of nutrients, okay? So when you have type 1 diabetes, it means that your body is not producing any insulin. Your pancreas is totally out of service, so to say, and so you are not having insulin circulating in your body or very negligible amounts of insulin in your body, and therefore we must give you insulin to sustain your life. What does insulin do in our body? Insulin is what takes our food from the bloodstream, opens up the cell, and lets our body receive the food in form of like glucose, amino acids, your proteins, your amino acids, and your lipids into the cells, and therefore then you get nourished. So when you do not have insulin, then all these things are retained in the blood. And one of the easiest ones to measure is glucose. So what you notice with both type 1 and type 2 diabetes, how do we diagnose it? By high glucose levels. Now, what's the difference with type 2 diabetes? In type 2 diabetes, you have a relative lack of insulin. Your insulin production may be very high because the basic problem in type 2 is called insulin resistance. So your insulin level you may be found when your insulin levels are very high, trying to overcome the insulin resistance, or as your insulin levels are waning. So sometimes your insulin levels may be normal but not able to cope. And then finally, we can also get you when your insulin levels are now also going down as the pancreas tires out. So type 2 diabetes is characterized by insulin resistance, the body not being able to receive insulin at the cellular level and therefore access glucose from the blood. So just like type 1 diabetes, we'll only know you have diabetes based on a blood glucose test, and secondly, based on your signs and symptoms. Now, type 1 diabetes presents very, very dramatically in most people, so they are often much easier to diagnose, but type 2 is subtle. It can come in very slowly over a number of years. So you can walk with type 2 diabetes without knowing. And it is the reason why you often hear us referring to diabetes as the silent killer. What propels type 2 diabetes is related to your lifestyle. When do you sleep? How you eat? What you eat? How much you eat? Whether you exercise or not, your stress level, among other things. And that is why when we manage diabetes, we always address lifestyle, because those lifestyle components affect your blood glucose. So that's in a nutshell what type 1 and type 2 diabetes is.
That was very comprehensive. We have one more question right from YouTube. Can you explain more about HbA1c?
We have doctor in the house.
HbA1c is a test for checking long-term diabetes control. Now, HbA1c, the other name for it is called glycosylated hemoglobin. Now, within your red cells is the pigment hemoglobin, okay? So within the hemoglobin it's a protein that carries your heme, and it is within the heme that your glucose is carried. Now, for every glucose molecule carried in the hemoglobin there is a mark that can never be changed. It changes the way the hemoglobin molecule is configured. So what happens is when we are doing a hemoglobin test, we test for the percentage of change within the heme structure. So if your hemoglobin has carried a lot of glucose, meaning that your blood sugar is high, then the percentage will be higher. And if your blood glucose, your body has been carrying, the heme has been carrying little glucose, then it means there has been little circulating glucose. Now, because hemoglobin lasts 90 to 120 days, HbA1c gives you a picture of what the blood glucose has been in the past 3 months. So when you get a HbA of 7%, let's say today, it means over the past 3 months, your blood glucose has been averaging 7%. Okay? So there is also a shortfall for the hemoglobin. If your sugars go up and down, then you get a sometimes nice average. So it also has its limitations. But HbA1c is our gold standard currently for long-term glucose control. It cannot be used alone. You either have to test your blood glucose also daily with a blood glucose meter, and especially if you're type 1, or you can wear what is called a continuous glucose monitoring system to also help you manage the daily changes in blood glucose. Hemoglobin gives you the average over the past 3 months.
All right. Well, thank you. Thank you so much for the comprehensive explanation. Any other question in the chat?
Yes, we do have.
All right.
It reads, what happens to a diabetic on HIV drug treatment, which has highly suspected to promote direct fat accumulation and adipose tissue, fat cell accumulation and adipose tissue fibrosis?
Mm. Yeah, this is usually a difficult situation where you have HIV as well as diabetes. There is a big problem there usually because normally when you take the HIV drugs, they promote a lot of fatty tissue, and sometimes, as Mercy has so rightly indicated, you can even get adipose fibrosis. Okay, now as you get fat accumulation, what happens is insulin resistance goes up. Fat is one of the things that fuels insulin resistance. So adjustments to your diabetes medication is important, but more important also is also your dietary management. Okay, if your diet is well controlled and there is collaboration between your care professionals, the one taking care of the HIV as well as that for diabetes, then you can have very decent care. Over the years, I've had several patients who have both conditions and have managed them successfully. Most important is one, adherence to your medication, two, regular follow up and response to the changes early. So if you do your follow up regularly without missing your clinic, any changes can be addressed in good time before it goes out of hand. But it is a holistic approach that just does not involve your medication alone. It also involves your lifestyle. So exercise is still important, your food, your sleep, everything is still important. Yeah.
Yep. Thank you.
All right. Well, we have another question. Does moringa have any effect on blood glucose control?
At least.
Yeah. So all these herbal medicines, they have a place in your health and care, but we cannot say that it can control your blood pressure because no studies have been done to be for us to find out that 1 teaspoon of sugar will lower your blood sugar like this. So if you want to do herbal treatment, it has to be it is adjunct therapy, meaning you have to take your medication and take these herbs, and then you monitor your blood sugar. Unfortunately, some of these herbs also interact with these medications and interfere with them, with their function. So the best thing is, we always say, start with your lifestyle. Remember, diabetes is a condition that affects the way your body uses food for energy. If you don't change your diet, whatever you do, you take herbal medicine, you take medication, it can only get worse. So the first thing are the natural doctors: your diet, your exercise, your sleep, your movement, fresh air, water, all these things. So there's a place for herbs, but we cannot say take moringa and it will reduce your blood sugar like this. No. But it is also, moringa is good for other things. It is very high in antioxidant properties, and so you can take it, but it cannot replace the medication. It will help with other things. Thank you so much.
All right.
Yeah, you have 2 minutes for more questions.
All right. So let's take this one. What can you say about people using diabetes medication for weight loss?
Yeah, the GLP-1s. Yeah, this is a very big problem, you know. The GLP-1s, especially, you have the Ozempic, Januvia, etc. You know, those drugs are now currently being actually abused for weight loss management. Now, the issue with a lot of these drugs that are currently being used rampantly is some of them now are starting to show very serious side effects, you know, to the point of even renal failure, blindness, you know. People are just buying these drugs, using them with no supervision at all. And what we have now is a looming disaster. Okay. So these drugs were not meant for weight loss. Weight loss is actually a side effect. And so that is the reason why they are being abused. We have to be very careful, even for those people who are using these drugs. It is very important at the start of using this drug for weight loss that it is done carefully. It is done in a titrated manner, slowly over time, as well as with lifestyle, because remember, these drugs, one, they're very expensive. We are now seeing that they have some serious side effects. And at a point in time, you may need to get off them. Now, if you had not adopted and maintained the critical lifestyle that can help you beyond them, then that becomes a big, big issue. So people need to be very careful with the Ozempics and its other sisters, because they can really damage your health. Alice, you should comment on this as well,
Yeah, I mean, thank you. So actually, it's these drugs are beneficial, but they also have serious side effects. But over the last 27 years, this is one of my mottos, my favorite quotes. Taking drugs without eating properly is like washing your hands and drying them in the dirt. In fact, just like right now, I was looking for a YouTube video that I watched about celebrities who took what they looked like before they started taking Ozempic and all this medication. I wanted to share it, and I'm going to share it, or you can try and find it on YouTube. So it is just lifestyle. I have seen one or two people who took Ozempic and they took it for so long and they were always weak, very tired. They cannot do their normal daily activities. And this is because, semaglutide, what it does, it slows down the emptying of your stomach. So that means you eat very little. And so the danger is you actually get malnourished. You're not having sufficient nutrients. And then because you're not having enough energy, you also break down your muscles. So you lose your muscle. And sometimes the people I saw, the two people I talked with, they are too weak. They are too weak to do any activity. So it actually changes your life. So unless somebody is extremely obese, they can't get off their chair or their bed, then, there are other ways that we can do. Some of these things, if you have to take it, then you also get lifestyle. But we also have a success story of one of the clients who wanted actually to go for the surgery. She wanted to go for obesity surgery. She was in season 6. Dr. Jalango, you remember her? She wanted to go for obesity surgery, but then she ended up in another doctor's office instead of the surgery office. And the doctor says, no, go for lifestyle. And she did season 6 and she dropped 10 kilos. And she said, well, she saved like 300,000 equivalent Kenya shillings, So sometimes people, I've realized that weight loss is a multi-billion market. People will just say, take this soap and rub it in your stomach, and you go for it. And people pay money. Take this medication and take it, and people just go for it. So it's always good if you really want to use these medications or you've been prescribed for, talk to your doctor, ask all the questions, talk to a dietitian, and let them give you the help that you need. Don't just do it on your own. No. Yeah. Thank you.
Well, thank you. Thank you so much for the questions. Thank you, doctors, for tackling the questions as well. So as we come to the end of this launch, I'd like to leave you with this thought, that the future of your health is not determined by your diagnosis. It is actually determined by the choices you make starting today. So over the 12 weeks, we invite you to make a commitment to yourself, a commitment to learn, to grow, to ask the questions, to take action, and to give yourself the opportunity to become healthier, actually become healthier than you are today. You do not need to be perfect. You do not need to change everything overnight. Small steps can lead to extraordinary results. So remember, diabetes is not a journey you have to walk alone. You now have a community of experts. Over the 12 weeks, you will meet more experts that will come in handling different topics. So stay tuned every Monday, 8 p.m. East African time. On behalf of the entire DTLC team, I would like to extend our sincere appreciation to Dr. Ojwang for her vision and her leadership. We also thank you, Ms. Atieno Jalango, for sharing the DTLC achievements and reminding us what is possible when knowledge is combined with action. To everyone who has joined us this evening, thank you for taking your time. Thank you for trusting us and your willingness to be here to invest in your health. We look forward to working with you this journey over the next 12 weeks. So until next week, Monday, 8 p.m., stay encouraged, stay committed, and remember, your diagnosis is not your destiny. Welcome to DTLC Season 13. Good night, friends.
Good night.
Yeah.
Good night.
Good night.
Record.